My designation was under aerospace engineering. I think that's probably giving me too much credit.
You're with this tech company in North Carolina, and you're doing asset management there for them. What does your career trajectory look like?
I started out at the lowest level of sales. I finished dead last. And 2.5 years later, I was the number one salesperson in the company.
It is a feeling of helplessness when you're relying on the experts to care for your loved one and get them back to health. I don't think enough thought and attention is paid to the circle of family and friends around the patient.
Are you sick and tired of the high costs and inefficiency plaguing our U.S. healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to another episode of Broken Healthcare Podcast. I am delighted to have with us in the studio, well, I'm in my studio and he's in his studio, Daniel McCauley. Daniel, welcome to the big show.
Thank you, sir. Happy to be here. Thanks for having me.
Right on. So Daniel and I were part of the same mastermind group. And I like to have like-minded advisors on because the whole concept of this show is not to kind of, in the insurance industry, when it comes to brokers, it can be like a very catty, contentious kind of relationship. I'm doing this, you're doing that. I'm not sharing any of my secret sauce with you. Don't share any of your secret sauce with me. You do you, I'll do me. And I think that's part of the problem in healthcare today. It really should be more of folks should be focused on their clients and they should do the best that they can for their clients. So the idea of joining a mastermind group, and the first time that I heard the term mastermind was back to Think and Grow Rich, the book by Napoleon Hill. And it was the concept that no one person is as good as a community of people. If you have a bunch of people that are thinking about the same problems, then that combined brain power is better than you could ever be on your own. And so I really appreciate and I value folks like you, Daniel, coming on and sharing what they're doing on the broker front, because I'd like to think that, where our approach is not status quo, our approach is different. I always take the approach of, my client comes first. Let's talk to them and have a dialogue about what's important to them, what's important to their organization. Is it money? Is it people? Hopefully it's both, and there's a blend and a combo there. But before we get into all of that stuff, you have an interesting background. And I always like to say, no one ever kind of picks the insurance business, right? Yeah. You kind of fall into it, or the road is never a straight path. Yeah. And you have an interesting background. I think, if I'm not mistaken, did you do some service in the military?
Yeah, I did. I was in the Air Force for 6 years.
6 years. Well, let me start then by saying thank you for your service. That's we need more men and women like you that are willing to serve. I personally did not serve. My dad served, but big shout out to you, and thank you for your service. That's much appreciated. So I would imagine you were a young man when you went into the service. Was that like your first full-time gig, or to kind of take us back? How'd you end up there to begin with?
Yeah, so I had the dream to play basketball.
Okay.
I woke up and that after high school, that's kind of where my mind was. And so I ended up going to school with that kind of being a focus, and then realizing this isn't the direction that's best for me now. So I went in the Air Force at 19. I signed my paperwork at 19. Um, and yeah, like, I mean, in all honesty, probably signed that paperwork without even understanding what I was signing and like what it meant. Like, if I'm honest, my dad served. My dad was in the Air Force during Vietnam, and he's a part of my story with this. And so, uh, I looked at it and was like, I want to serve my country, and I want to be able to learn something about life that is foundational, which is something that the military brings. Like, at minimum, it will bring you discipline, and I think that was about all the thought that I had going into it. And fast forward to 6 years later, is the best decision I've ever made. In my life, that by far has changed the direction of who I am more than anything else has.
Did you just were you solicited? Were you headhunted by like a military officer, or did your dad say, "Hey, this would be good for you, go down and do it," or did you just do it on your own?
I just did. Oh, I mean, I asked him. I was like, "Hey, I think this is what I'm gonna do. What do you think about it?" And he told me all the pros and cons, way more pros than cons. And so I reached out to a recruiter that was not too far from me, and started that whole journey proactively on my own. Yeah.
Huh. Wow. And so you get recruited, and I guess you go through some basic training. How did all that roll out, and what did you do? What did you do for our fellow Americans when you served?
Yeah. So I'll go backwards in how you asked me, but like my designation was under aerospace engineering. I think that's probably giving me too much credit. I don't, I
Okay.
don't. I think when people hear those two words, they're like, "Man, this guy's really smart." And I don't. I was telling another guy that's in our group, Ben Connors. I was telling him this yesterday. So that saying about how um, people want to get, some people are out here playing checkers, and I'm out here playing chess. I was like, my version of that saying is, I'm not smart enough to play chess, but I'm real hard to beat in checkers. And I think that's my version of
Oh,
aerospace.
that's great.
Yeah, that's
Yep.
that's my version. So I was essentially an airplane mechanic on KC-135, which is a refueler. It can actually refuel three planes in the air at the same time. So it does air refueling, which is wild for a lot of people that don't know much about it.
Yeah, that's so cool.
Going all the way back to basic, which I haven't thought about in a while, but going back to basic, I remember, you're in a metal bunk bed from think of it like dorm room style, except for everybody's in like a bay, right? You have all these metal bunk beds lying next to each other, and I think these buildings are built in like the 50s or 60s. Um, and I remember, you're laying in. I was on the bottom bunk. I look up. The bottom of the top bunk is like this chainmail looking, bed spring kind of looking feel that the mattress sits on. And
Yep.
I remember looking up at it and being like, "What did I just do? What am I doing?" You're laying there in the dark,
So
and
you're
you're
saying
like, "Oh,
it was not the Four Seasons.
it's not the Four Seasons. No, not even close. Not even close." But it was cool. Like, basic. I was at basic for a few months, then I went to the training specific to my job for a few months, and then went to a bunch of different bases after that. And yeah, it was a great journey. Absolutely great
Well, I
journey.
mean, and I know you're being a little self-deprecating with saying, the aerospace engineer makes me seem too smart, but you had a really important job. It's you got to keep those birds
Yeah.
flying, and there are lives that are depending
Yeah.
upon you doing your job and doing it well. And so
Yep.
that's really cool. Um, and so fast forward, is that what you did throughout your career in the military? That one function, um,
Yep.
and where did you go from there?
Yeah. So Air Force was 6 years. My last year in the Air Force, I got introduced to a tech company in North Carolina that at the time there was probably like maybe 50 employees, 60 employees, something like
Hmm.
that. They had been around a while, 10 years or so, and we're really focused on entering into new markets and scaling. And so I started there when I was 20. I was 24. I started there at 24, and I was there a little over 8 years, and saw more than I could have ever bargained for, dreamed of, and just in a career experience and working in the tech space. And the type of tech it kind of fell under infrastructure management. So it was asset management in general, which was very similar to the kind of stuff that I was doing in the military. So it transferred well. And over that career and working in the tech space, I don't know, we went through three different private equity events.
Well, hold on one second, Daniel. So asset management, you said you were essentially an airplane mechanic. So
Yeah.
how is that asset management?
Yeah, so like if you think about the plane as any other kind of asset, like your house is an asset, you just think of a
Yep.
plane like that. The um, the maintenance of that, whether that's corrective or it's preventative or it's even predictive,
I see. Yeah.
um, that's all tied back to the life cycle of that asset. Well, the plane
Yes.
that I worked on, it's been a while since I've looked at this, but I want to say it was the plane I was working on. All of the KC-135s were built from like 1955 to 1963. Don't quote me
Wow.
on that, but I'm pretty
Yeah,
close.
yeah. Right, right.
Um, and so you think about asset management on something that old.
Yeah.
You've got to do repair versus replace and corrective versus preventative maintenance, down to the letter.
Yeah.
So
Yeah.
that's kind of how it transitioned. Well, like that airplane asset management is probably because it is life dependent, right? Like it's probably one of the most meticulous types of asset management that you could find.
Yeah, and that sounds like a long time, in terms of years. It's, 60, 70 years is kind of the range that you're talking about. But so I remember reading a book, Airframe by Mike, I think it was Michael Crichton.
Mhm.
And, he talks about when they build an airframe, the engineering design is like 1,000 times service life. It's ridiculously over engineered,
Yeah.
right? And so when you're, talking about the span of 70 years, these things can, that's really nothing
Yep.
in comparison to, what it was designed to do. So
Yep.
I got that. So now you're with this tech company in North Carolina, and you're doing asset management there for them, and
Mhm.
so you're there for 8 years, from 24 to 32. What does your career trajectory look like while you're there? Are you in the same spot? Are you getting promoted? What types
Yeah.
of deals are you doing?
Yeah, it's funny that you're asking me this. I haven't talked about this in a long time. Um, the yeah. So I started out at the lowest level of sales, um, and my first year, my first full year, I finished dead last.
Okay, good
Out of,
job.
out of the whole company, yeah, right, right. Out of the
Right.
whole company, I finished dead last, and I'd never
You,
really sold before. I'd worked in like retail environment stuff like that, but I'd
yeah.
never really. I've been a bartender and server and done different kind of stuff like that, but never really sold
Yep.
anything. And so I finished dead last in my first year, and about my 15th month of being there, I was like, hey, maybe this isn't for me. Like, I don't, I don't, I'm not getting, I'm doing everything I can. Like, I'm working 60, 70 hours a week. I won't get up and go to lunch. Like, I'm doing
You
what,
weren't slacking. You just weren't having any
yeah, yeah.
success.
No, no, no. Honestly, one of the things that made me pick working there is I was making cold calls, right? When I first started, I was making cold calls, and I'm
Yeah.
working in the military. And the guy that I'm talking to, is like, okay, so this is what the job entails. You're gonna make, $33,000 a year. You're gonna be working from 8 to 5. You're gonna have a cubicle. You're gonna be making, calls. We expect you to make, I don't remember the number, but let's say 70 calls a day. And I cut him off, and I was like, wait a second. You're gonna pay me $33,000 to only work from 8 to 5 Monday through Friday, and all you want me to do is pick up the phone and call people? I was like, yeah, I'm on board with that. And at the time, again, coming from working out in the flight line or doing that kind of work, I was like, yeah, I'm on board. So, fast forward to this 15-month time frame, I'm sitting there going, I don't know if this is for me. I'm terrible at this. Like, nobody's bought anything from me. And there was a guy I worked with, which he was my manager at the time. He ended up stepping down from management, but he was my manager at the time. He was like, "Why are you asking anybody to?" And I was like, "What do you mean?" And he was like, "Are you asking anybody to buy it?" And I was like, "Of course I'm asking people to buy it. Every time that they show up, they know that they can buy it." And he's like, "That's not what I'm saying. I'm saying, are you actually asking anybody? Do they want to buy it?" And I was like, "No, I mean, I've never said those words." And he was like, "Well, go start saying those words on the phone and let me know what happens." So he gave me 2 questions to go ask. He said, ask them, is it a fit? And if they say yes, ask them, do you want to buy it? And I mean, I asked people that. I asked everybody that was on the phone with me that question, those 2 questions back to back for 2.5 years straight. I mean, everybody. To
Wow.
the point where,
Really?
the guy that had stepped down from management, he was like, he's now kind of more colleague at this point. And 2.5 years later, I was the #1 salesperson in the company, which is,
Wow. That's
yeah,
crazy.
yeah, which is when all this happens. And I go, hey man, I just wanted to say thanks for really helping me, da da da. And he was like, yeah, yeah, absolutely. But what were you talking about? What specifically worked? I was like, you remember when you told me to ask those 2 questions? Is it a fit? Do you want to buy it? And he was like, what? And I was like, you don't remember telling me that? And he was like, no, I don't remember telling you that at all. Like, almost like he had made it up on the spot to get me out of his office because I was the worst
Oh, that's
salesperson in the company.
great.
And so, like, we're good. We're really good friends. I saw him, I don't know, maybe a week ago.
Yeah.
I still credit him to a certain aspect of my success in my life, and it's funny because he didn't even really recognize what he was telling me. And back to
Dude,
my
that is such an incredible sales lesson for, so our audience is pretty diverse and we may have salespeople from all walks of life. That we have people in our circles and, plenty of, aspiring brokers out there. And it's so simple what you just shared and so telling and amazing.
yeah,
Thank you for sharing that because yeah, here you're the same Daniel McCauley that showed up the day after you were given that advice as you was the day before. You were
right,
just asking the wrong questions,
yep,
right? Or you
yep,
weren't asking any questions at all. And those two things took you from, the Michael Jordan of your basketball team to the Michael Jordan of the Chicago Bulls World
right,
Championship team.
right, yep,
Right. So
yep.
amazing. That is so fucking cool. And so now you're at the top of the heap. You would think, why mess with success? Why what happened? Why would you spin off of that?
Yeah, and I add a little more context to it too. I think one of the things that benefited me a lot is I stayed as an individual contributor. I stayed as a high level salesperson the entire time. I never went into management, and um, that can limit you making those kinds of decisions. And it didn't limit me because I got brought into and saw a lot. So, like when we would acquire a company, I was one of a few people that would get into that room with different executives and talk about how's the market going to actually consume this. And so the
Mm,
learning lessons that I had, the ability to access, uh, helped me tremendously. And I don't want to skip over that part of the story in the sense of like, I didn't just learn how to sell. I also learned how to
yeah.
evaluate a whole lot of things in relationship to business because of the amount of growth that we went through. I mean, when I joined this company, I don't know, they might have been doing $10 million, $15 million in business, and they sold to Siemens a few years ago for $2 billion.
Wow. That's
And so
incredible.
that we acquired companies from Australia and the UK and in Canada and all these different scenarios, and like I got to see all of that, be a part of all of that, because I was one of the few people that would get tapped on the shoulder of like, how will your clients understand this? What will they how will they evaluate it? What's important about the market? That kind of stuff. So
Yeah.
um, I'm lucky in the sense of I got to be pretty well rounded without having to change the trajectory I wanted to go on career wise. Um, so
Hmm.
back to your question though, I think part of me having that well roundedness ties into this, but I left the tech space honestly to hang out with my dad. That's which is crazy to say, but it's true. Like my dad is 80 now. At the time, he was, I don't know, 75 or something like that, 76. And has been. I told him I was going to tell his story, so there's nothing he can do now. He's kind of held together by duct tape. He's had a lot of health things happen over the last 20, 30 years of his life. My mom is
Well,
the
this is
same.
broken. This is the Broken Healthcare Podcast. So do tell.
Yeah, yeah, yeah. So he's had a lot happen. A lot happen. But at the time, which we can talk all about, I'm happy to share any of it. At the time when I decided to leave, I looked at it and was like, he's mid 70s. I don't know how much longer he's going to be here,
Yeah.
and I'm not rich by any means. I can't just kick my feet up by any means, but
Yeah.
if I lose every dollar I have, and I hate the insurance business, over the next 4 or 5 years, um, at least I might have spent, instead of me talking to him once a week or once every other week or whatever time allowed, I'm now talking to him 4 or 5 times a week. I'm seeing him multiple times a week. Even if work is what allows that to happen, that time that just naturally happens when you're spending more time with family, that you just talk about life. I knew I was never going to get that back, and so I
That's
made the
awesome, dude.
decision. I made that decision to leave something similar to how I joined the Air Force, kind of blindly. So maybe
Yeah.
that's telling. I don't know. But yeah, that's what made me.
Sometimes we're impulsive, but what I'm hearing is that's an incredible love story. You're a military guy. You're a macho man. There's no denying that. But at the end of the day, you made a decision to be with your dad out of love, and that's just incredible. I mean, it's really bringing a tear to my eye. Like I have a son and a daughter, and I think that's if you're on that track and you have a child that makes a decision that you made, it tells you that you're doing something right. So good on him for raising a good son. Do you have brothers and sisters?
I got a younger brother and an older sister,
Uh
and
huh. Cool. So there's three of
it's
you.
funny. Yeah, it's three of us, and this is weaved in. I have a 15-month-old son, a little over a year. I named him after my dad. His name is Arthur, and then my business, Mac Consulting. Mac is actually a nod to my dad as well, because that is his grandfather nickname.
Oh wow. Very
So
cool.
all
Very
tied
cool.
together.
Yeah. You make a decision to jump in to the insurance business because that's what your dad was doing. And
Mhm.
was he doing the types of things that we do now, or
Nope.
what was he doing?
Yeah, that he was not doing the that things that we do now. The last 25, 30 years, he's been in voluntary specialist. He's been in insurance since he was 20, 21.
Okay.
So
Wow.
he's kind of done all of it. But last 25, 30 years has all been in the voluntary space on really, really large group stuff.
So it sounds like he came out of the military and went right into insurance,
Yep,
pretty much, right? Okay.
exactly. Yeah, exactly that.
And so you jump in, and where'd you go from there?
So I started on voluntary. The first 12 months or so, I was doing voluntary work with them and his company. And it took me to it took me to health insurance on accident. We went to tell this story, we went to Next Gen, which, you know, how we know each other. We went to that Ascend
Yeah.
conference. So, you know,
Yep.
small plug to Nelson Griswold and Ascend.
Yep.
I've learned a tremendous amount since that, but I go to that in January of 2022.
Okay.
And I show up as a voluntary guy. Like
Yep.
we had partners who were there that that's the reason I went, and that's how I found health insurance.
Okay. So, you know, 2.5 years ago, you kind of jumped in and said, well, you attended Ascend, and yeah, shout out to Nelson Griswold and the Ascend conference, and you could Google that and find it for advisors out there that, you know, just want to kind of get a better sense of what the possibilities are beyond, you know, the traditional status quo that you might, you know, see through traditional channels. And I guess I think it was. Did you hear Lester speak at Ascend, and did that kind of get your juices flowing?
Yeah, yeah.
Lester Morales.
Yeah, I'll tell you that story. So Lester is talking all about data up on stage, and he's talking about it in the medical
Yep.
world and health insurance world, and obviously that's the world I had just came from. And it there was a large part of me that didn't believe it. That was like just blown away that I'd never heard it, because again I had lived in that world and I had seen a lot globally about what people are doing with information. And it's the only time in my life, if Lester watches this, he knows this to be true. I've told him this. He's the only speaker I've ever walked up to, you know, right after, you know, they get done talking. I don't know if that's an ego thing or a pride thing. I don't know why, but I've never walked up to somebody right after they get done and be like, "Hey, I want 5 minutes with you." And
You
I
got all
could,
fanboy.
yeah, I couldn't help doing it to
Oh my
Lester. I was
God.
like, I walk up to him and I'm like, "Hey, man, everything you were just talking about, is that true? Like,
Yeah.
all that's real?" And he was
Yeah.
like, "What do you mean?" And I was like, "Well, this piece and this piece and this piece, like, how much of that's
Yeah.
opinion?" I gave him a little bit of my background and was like, I want to know exactly where that's coming from and how much of that's utilized and if it's real.
Yeah.
And my reason for asking it is tied to my dad as well. Like, one of the things he talked about was quality data.
Let me just interrupt you there. So for, you know, those who don't know Lester Morales, he kind of runs in the same circles as Dan and I, and he's an accomplished public speaker. But his background is in the traditional broker channel, working for one of the big box brokers, one of the giant brokerages out there. So he has a ton of experience in just their processes and what they do on a day-to-day basis, how they think. And so when he goes on stage and gives a talk, he's coming from a place of someone who is highly accomplished in sales at one of these really successful brokerages. And so he's speaking from a place of fact. And what Daniel was hearing was him talking about his experience in that world as compared to what is possible. And Daniel was like, is this for real? Right? Do I have that right?
100%.
Yeah. So I'm sorry to interrupt. Continue.
No, you're. I mean, that's 100% accurate. Like, I was one of the people. I think one of the things that's interesting about living in the innovative side of healthcare is that how many people don't know that what it means and the access to information that you have. And I was one of those people 2.5 years ago.
Yep.
Yeah. So yeah, one of the things he talked about was quality data. And right before I went into the military, my dad was in a medically induced coma for a total of 60 days in the hospital.
Oh my God.
And
Wow.
yeah, yep. And he, you know, during that time, he actually he lost 75 pounds over that 60-day period. And my dad's like, I don't know, 5'8", 180 pounds maybe. So like, we're talking
Wow.
about
Okay.
you know, my dad's not 6'5", 300 pounds, just for reference, right?
Right.
Uh,
Right.
and
Wow. That's a tremendous amount of weight to lose.
yeah, and he had all this stuff going on with like just organ stuff and gut, like just it was just a mess. Well, one of the things
Yeah.
they ended up doing was removing his gallbladder,
Hmm.
and at the end of him, going through this whole process, they couldn't tell him what was wrong with him, and so here I am in my 30s listening to this story to Lester, and he's talking, and I can't stop thinking about my dad was in a medically induced coma. He lost all this weight. It was terrible on my family. We're thinking we're going to lose him. They remove his gallbladder, and the thing that kept sticking out of my head was we never found out what was actually wrong with him. How is
Oh
it?
God.
How is it that you can remove a body part but not know what's wrong with somebody? And I'm not
Yeah.
saying gallbladders. It's not. I'm not. It's not like your heart. I'm not saying it's like there's probably a scale there, but
Right, but it is a body part.
it's still a
It
body
is a
part.
human organ, right?
You're
Like
right. Right.
it's got some purpose, it's got some function.
Right.
And I hope you have a good reason for taking it out. Tell me.
Right. Right. It's still. We're still talking about something you were born with that you have now no longer have, and
Right.
it messed me up. It really did. Sitting there and the listening to Lester, I
Well,
was
that's the
emotional.
other piece of it, Daniel. I part of what's broken in healthcare is the fact that it's not just the person that's going through the medical event. It's all of the people in their little microcosm that are their sons and their daughters and their wives and their husbands and their
Mhm.
sisters and their brothers. It really has an impact on everybody. And
Yep.
when you have your dad that's lying there in a medically induced coma, it's got to be an incredibly helpless feeling. And
Oh
it's
yeah.
just it's your emotions are just kind of shot, and it's compounding, right? Because every day it's like, God, I hope he snaps out of this today. I hope, I hope there's a light at the end of this tunnel, and especially if you see him withering away there. And I think that was part of, the huge problem. And I've heard Dr. Marty McCary talk about this during COVID, when people lost their loved ones and they weren't allowed to be with them in a facility. God, I hope that's something. I hope we learned a lesson from that, and I hope hospital administrators, if any of them are listening to this, there's a human component to this that goes beyond the patient that's in your hospital bed. And God, I hope it's not a revenue decision. And it is about protecting staff. But being, somewhat cynical, knowing what I know about healthcare, I can't help to think that it means less security and less this and less that. And, it's like, come on, though. Like when we have loved ones that are going through a battle with an illness and they're in a facility, for Christ's sake, let their loved ones, be there with them. I think there's a component to it that is not just morally the right thing to do,
Yeah.
but it's also part of their ability to heal and get better, to surround them with loved ones. Now, that wasn't your experience. You were there and you were able to be with them. But I'm just, it just strikes a nerve with me because it's ridiculous that people had to lose their moms and dads and loved ones, and not be at their side during this pandemic that we went through. It was one of the darkest times in our lives, and hopefully there'll never be a repeat of that. But I'm sorry to kind of do that sidebar, but it just brought to front of mind for me that it's not just the patient that goes through this. They're going through the pain and the suffering and the bills and the expenses, but it's everybody that they're connected to that's on this ride.
Oh yeah. I mean, I you know, 19-year-old me, pre Air Force me, you'd have had a hard time telling me I couldn't go see him.
Hard time, and maybe a couple of really big guys.
Yeah, yeah,
Small army.
yeah.
Yeah,
You just would
I'm
have
with you.
you just would have had a hard time telling me that.
Yeah,
And
yeah,
it's because, like, you're right. Like, emotionally, the doctor's job is to take care of the patient, and I understand that. I do. And I don't know. I've grown up around healthcare because of basically my dad being tied together or held together with duct tape, which I joke about, but like it's a way to use humor to like hide some of the things that have probably happened that
yeah,
are traumatic, right? Like they
yeah,
are.
yeah,
And, yeah, I mean, I think it's just it's just looking back on that time and re-feeling that, right? Like you don't go back to that place in your mind. You're not
yeah.
doing that on purpose. You're not trying to revisit that door in your head, right? And
Sure.
I think that emotionally that's what happened to me in January 2022. That's
Yeah,
what, like,
yeah. You got sucked back.
I opened that door back and was like, holy mackerel.
Yeah. Yeah, no, and I think that's part of what drives me as well. Like I lost my dad when shortly after my second birthday. He was an oil burner mechanic. He was around asbestos when he was a kid, and who knows what the root cause was, but he developed lung cancer, and it was he was a big strong guy, and all of a sudden, there was this diagnosis and then a downward spiral. And I was a baby, so I didn't, I lived through it, but I didn't live through it like my older brother, who was 10 years older than me. He was like, to be a 10 or a 12-year-old and see your hero wither before your very eyes. To this day, it's PTSD, and my oldest brother is actually 18 years older than me. Really, really tough on them. And it is a feeling of helplessness when you're relying on the experts to care for your loved one and get them back to health. It's something that I don't think enough thought and attention is paid to the circle of family and friends around the patient. And case in point, you're sitting in a conference not expecting to be emotionally sucked in, and here's Lester, and he's got his own story about his dad and what he went through, his own medical story about a family member, his childhood hero, and you get sucked right back in because you went through very much the same thing. And I think it probably did for you what it did for me is it gives you a sense of purpose, right? Because there are lots of ways to make a buck in this world, but if you can figure out a way to make a living, and I make no bones with my audience about the fact that I'm an entrepreneur, I'm a capitalist. I'm not here to say that money doesn't mean anything, and I'm here to just kind of do this and for the hell of it. No, this isn't a hobby. This is a job. But I think I want to earn. My responsibility to myself and my family is to earn as much as I can, being the best at what I do. And if I can simultaneously lift other people up and make them better, that's a win-win. And that's why I do what I do.
Yeah, I mean,
So
I agree. You're not gonna hear anything different from me.
I didn't think so. So I think there is definitely that overlap, that we share the passion of doing the things that we do. So that kind of sets you on this. Okay, you decompress with Lester. He's like, yeah, no, it's everything that I set up there is I'm speaking the truth. And then that led you, I guess, to chase down Nelson the same way that I did once upon a time and say, I want to be a part of this, right? And then you join the mastermind group.
Yep. Joined the mastermind group early that same year, right after Lester, basically.
Yeah.
It was Nelson's conference, so I met with Nelson like maybe the next day, and said, "Hey, I want to do this," and been a part of it ever since.
Awesome. And so you've had some. I know that you're modest, but you've had some amazing success transitioning from what you were doing to healthcare as a healthcare broker. in terms of the velocity and the speed at which you've had success, I think is nothing short of remarkable. I'd love for you to talk a little bit about just kind of what your experience was transitioning from voluntary to healthcare and next gen strategies. And did you have, someone whisper in your ear and say, there are just two questions that I want you to ask?
Yeah.
Was it one of those things, or how did you, this is kind of baptism by fire for you, but really remarkable. And I'd love for you to share some of, if you don't mind, just some of the numbers, without naming names.
Yeah. I mean, I think that, to give you a little context there, what has made me successful is I've invested time and money in putting myself in front of, surrounding myself with the right people. That the speed at which I've done that's the money part, right?
Yeah.
As far as being in the right room with the right person at the right time.
Yep.
And I've spent, I've spent the last 2.5 years with one real goal in mind, and that's I'm going to invest as much as I need to, as much as possible, to increase my knowledge in this industry of from two categories: what's wrong, but then what's the answer? Like what's the right way to build things from a solutions perspective, and that's not a small investment number, right? I mean, and in order for me to get to where I'm at now, and that if I think about the whispering in my ear, the whispering in my ear is that that was the right decision. The right decision is this healthcare cost perspective, quality perspective, those different problems that exist, people understanding the value of benefits and all that kind of stuff that's already tied into everything, really, from a benefits plan perspective. There's certain pieces that I knew, and the pieces that I didn't know, I went after them from a knowledge perspective more than anything else. I'm still doing that.
Right. So yeah, unpack that a little bit for me, because typically, what in my experience and what I've said before is, in my sales career, and I've been in sales now for since I'm a teenager, so a long time.
Yeah.
In one capacity or another, and another thing that we share is I've done many things. I've pumped gas, I've waited tables, I've bartended, I've always been a hustler, right? Yep. But sales has always kind of been a thread that is weaved throughout my life from a very early age. One of the hardest things that I've found, and you may disagree with me, but one of the hardest things that I've found that you can do is unseat an incumbent broker. Brokers typically are embedded in a client, and they tend to be excellent social creatures, people that have really good people skills, and so they're liked. Right? And it's hard to fire someone that you like, right? So go out to dinners, go out to the games, go out to the shows. There's all of that stuff. And what we've had, I think prior to you joining the mastermind, we had Marshberry come in. Nelson had Marshberry come in, and they're an analytical firm. Mm-hmm. And they shared some statistics with us, and one of the statistics was you could do a horrible job as a broker and keep your job. You could deliver increase after increase year over year, and the average tenure for a broker is 6 years. And so, typically that means when folks like Daniel or I or anyone comes knocking, there's a wall that goes up, right? It's like, hey, we're all set here, we're good, and it is a difficult, it's a challenge to get people to just suspend disbelief and open their eyes up to, well, maybe I don't know everything about this. Maybe it's at the very least, even if I love my broker and I have a great relationship with him or her, maybe it's worth it to just hear this person out so that I can at least do my job, do some diligence. And what's the worst that can happen, right? You do figure out that the math proves out and you're in the best possible place that you can be. But in my experience, Daniel, the hard part is getting to that point where they're just willing to have that conversation. Once we get past that, and with some little bit of basic data, we can show them numbers. Then the conversation starts to soften. But I don't know if that's your experience or not. But for me, it's one of the biggest challenges is just getting them to listen.
Yeah, I think a big piece of this is a big piece of my success is my background, in the sense of like how that plays out tactically. I have no idea how other brokers sell. No idea.
Yep.
I don't know if the things I'm talking about are the same things that they're talking about, or if they're talking about them in the same ways I am. I don't, obviously in our mastermind groups, we talk about this kind of stuff. So I know what our mastermind groups of it people are doing, but I'm not
Right.
out here.
Sure.
I'm not out here trying to, replace, you with me or vice versa. Right. So it's a little different. When I think about something that's in that, silver bullet kind of category, it's not a silver bullet, but like I am genuinely dumbfounded. It's not a sale. It's not I genuinely have been dumbfounded and still am with the fact that health insurance for a certain portion of the country, they pay their health insurance bill, their premiums, they pay it all year long. They go through the year, they get an increase, but nobody has to justify why they're paying more money.
Yeah.
Like from a business perspective, if I was paying you something and you told me, hey, Daniel, I know we've been working together for a year now. Our price has gone up 17%. Best believe you're going to have to tell me why our price is up 17%. And like, you're
Right.
going to have to explain that to me for me
Yeah.
to be okay with not, with just, consuming 17%. And
Back it up.
yeah, the fact that a certain portion of the country is in that kind of model where they're not getting any data that says this is why you had a good year, you had a bad year, this is how good or bad the year was, based on actual information that justifies the price. The fact that that's not happening, I'm not just my passion around that isn't fabricated, because there's still pieces of me that is blown away that that's a thing that people are choosing to do.
Yeah. It's not the way we manage anything, right? If you're a CFO listening, or you're a controller, you're a numbers person, you don't manage any of your expenses that way, right? You don't have a vendor come back to you at the end of the year and say, by the way, here's a 22% increase. And it's because your claims was higher. It was higher last year, even if you get that as an explanation. And it is what it is. And people accept this all day long in healthcare. Mm-hmm. And one of the brightest guys I've ever had the honor of listening to is Kevin O'Kane, and he's the founder of Catalyze Health, J&K Consulting. And he said, if you want to control the cost of healthcare, you have to do one thing. You have to manage claims prospectively, in advance. That is genius, right? Because what happens in a fully insured plan, you're looking in the rearview mirror. Oh, you had, $1 million in claims last year. You're only supposed to have 900,000. Your premium next year is going to be 1.2 million. Well, that's no way to manage an expense, right? So how do you manage an expense? Well, as the claim pops up on the radar, you need an MRI, you need a CAT scan with contrast, without contrast. You need a knee replacement. You need shoulder surgery. Well, how about doing the work on the front end to figure out where is the quality the highest. And in healthcare, it's counterintuitive, but quality and price are inversely proportionate. And the highest quality is typically the lowest cost. So where is the quality the highest and the cost the lowest? And well, what if you can get that same surgery for a fraction of the cost, 25% of the cost? Now you're not looking in the rearview mirror waiting for your broker to walk in with a 22 or a 17% increase. You've done the work on the front end to manage the cost of that claim, and you know going into next year where you stand this year versus last year, and that just to me makes a hell of a lot more sense.
Yep. Yeah, and I like
right.
I think again.
I mean, you were in the aerospace engineering space, but you don't need to be an aerospace engineer to just say that makes sense, right?
No. Yeah. And like, I don't think there's too many businesses out there that don't know that already, right? Like, you walk up to them and you say, "Hey, do you think you should be paying more and not being able to defend why you're being charged with?" No, like nobody's agreeing to that. And I think the thing that's probably helped me is I said I've gone down this road, and a lot of the help from two different mastermind groups I'm in, and looking at like, okay, if you're not happy with this in this scenario, my background is looking into data and understanding what that means from a business perspective. Forget health insurance. That's what I've been doing for the last decade. And I want to do that here. And I've got these people behind me that do these things. So like, just give me the same thing that you already have that takes you 7 minutes to pull together. Give me that. I'll turn back around and I'll tell you if I can help you or not. And I don't want you to trust me yet. I don't want you to think about me being your broker. I'm not asking you to think about changing anything in your business. I'm asking you to do one thing: share this information with me.
And be skeptical. We invite people, be skeptical.
Yeah. I mean, I was skeptical, like my story. It's normal to go, "Are you telling the truth right now?" as you listen to some of the things that me and you both know. It is normal.
Right. Well, it's hard. It's hard to wrap your head around the fact that there are programs like the PAP, the Patient's Assistance Program, that can source a $100,000 drug for zero. That sounds like fantasy, but we know it's not fantasy. It's true. It's not something that's possible if you're in a fully insured plan where the PBM is owned by the insurance carrier, because they don't want you to remove a $100,000 expense off of their plan, because that represents revenue to them. And so you just have to use common sense in the same way that you would use common sense in any other thing that you procure. Well, do that with healthcare. And ask your broker tough questions. If you love that broker and you've had a lifelong relationship with them, just ask them some of the tough questions. Tell them that you want some data. Take a look at that data. Reach out to a guy like Daniel. See if he could put eyes on that data and tell you if you're on the right track doing what you're doing, or if maybe you can cut that drug expense by 30, 40, 50, 60%, which is, we know this is possible. If your current broker can't do that, well, then you have a decision to make. Keep overpaying and keep your relationship going, or, test that relationship and see if you could still be friends, but do what's in the best interest of your organization and your people and make a change. Right? It's not that complicated.
Yeah, I mean, I think one of the things I've learned, I don't know this to be 100% true, but one of the things as an observation as I've been through the last few years has been, the market. I was on the phone with somebody today, 700 employees. I was talking to her this morning, and I said, "Do you know who your PBM is?" You know how you're doing this today. You know, and she's with a major brokerage firm, and she wasn't sure. So I'm like, just look at your ID card. If you got insurance, though, look at your ID card and just read it off to me, and I'll tell you who it is. And that person's on the phone with me, not because the employees don't understand their benefits, not because they haven't done enough, let's call it tertiary type benefit stuff, right? Like that are recruiting and retention, and those that are really drive that aspect of it. She's on the phone with me because she's unhappy with how cost is being managed. That's the sole reason she's on the phone with me. That's what she says.
Yeah. Yep.
And when you think about that, people are unhappy with the client itself. They are unhappy with the cost. And more of the industry has said, the only way I'm going to get a handle on this is if I understand health insurance better. The client, not the broker, the client is thinking
Right.
that.
Right.
And 10 years ago, the client wasn't worried about understanding health insurance. And like,
Right.
let's be honest, like nobody wants to talk about health insurance, including the two of us. Now we talk about it. It goes back to your job versus hobby comment, right?
Right. Right.
Nobody wants to do that. And so if these clients in the market itself, if a certain portion of them have now said, I'm going to play a role in understanding why my costs are what they are, that means that they can't be happy with whoever was managing it before they decided to play a role.
Right.
And when you tie those things together, you sit there and go, okay, well, like, if you feel the need to take this kind of phone call and you feel the need to play a role now with cost, like, why is that? Who
Right.
are the people that are managing that for you today? I'm not just talking about the broker. I mean the entire supply chain of
Sure.
healthcare related to your health insurance. Who are all those pieces that are managing or that exist in that supply chain for you? And where do you think the ball's breaking today? Like if that's a cyclical thing, where is it breaking? And why
Yeah.
are you saying it's breaking there? And you have that kind of conversation with somebody, and I think it helps them say, there's nothing that hurts me to have this person look at, their team, the advisors, the experts that they have behind them. There's no reason that there's nothing can go wrong with me going down this route. I also
Right.
think a big piece of this
Right.
is that you can't be afraid to have that kind of conversation with the client in the first, or the prospect in the first meeting. I think that's a big piece of it too.
Yeah. Well, good on her for, having the curiosity and the courage to, to get to the point where
Yeah.
she is engaging you, saying, help me understand this, right? Because there are so many that, and look, folks, like, I get it. This is what Daniel and I do for a living, right? Every day we're kind of at this, and this is our job. We understand that the clients that engage us, it's not their job. It's not their job to focus on insurance. They have a mountain of other things to get to on their desk, in their, work lives, in their personal lives. This is kind of a nuisance, right? But I think we're at a point now where it's a $5 trillion spend practically. And more people are starting to get it, whether you're an HR professional, a generalist, CHRO, all the way on up through the, through leadership. These are meaningful dollars. And if what we're talking about, honestly, this is a number one SG&A expense after payroll, typically. And if we can mine for savings in your health plan, and we do it every day, that savings drops directly to the bottom line. It is the creation of EBITDA. And so these are meaningful dollars that compound over time that can make a huge difference in the trajectory of an organization. The other thing, Daniel, is just like, so we're going to mastermind a little bit right here. I'm just spitballing here, but
Yeah.
I thought of this. I'm not even sure what brought me to this, but I think, you know what? It was just this morning. I wake up, and this is what I do for fun, folks. I turn on YouTube, and there's a guy called Dr. Eric Bricker. Healthcare A to Z, and he's got these little 3 to 5 minute, YouTube videos on everything that you could imagine in healthcare. Amazing guy. And he does one on conducting employee open enrollment meetings. So this is like the first thing I'm doing when I crack my eyes open in the morning.
Yeah.
And I'm thinking to myself, and he's talking about the importance of communicating benefits to employees. And that really is something that I think is just often overlooked. It's glossed over. It's rushed. What would you think about telling an employer or suggesting that they hire a professional photographer and go around and take pictures of their people doing what they do, maybe even trailing them on the weekends, and including that as collateral in an employee benefits guide? I don't know. I thought of that and I was like, you know what? I think that's a pretty good fucking idea. Like it's a small investment, hire a photographer. And instead of having, because actually Dr. Bricker, I think, said, like instead of having, like in a benefits guide, a dollar sign and, a chart and a this and a that, why not have people? And then I took it a step further and say, well, why not their people?
Yeah.
Right. So just the little things like that can make a huge difference. And those are the intangible things that, I don't think we think about enough. But it can, the whole idea, I think, of engaging our services, yours, ours, and the people in the circles that we run, we endeavor to make the organization that hires us better. And so I want anyone that hires us to really think of us as an extension of their internal team. They're really hiring us to sit on their side of the table, to look at what they're doing, and to mastermind and brainstorm with them about what the possibilities are. And, I just want to touch on your success. So you started you went to this Ascend conference in January 2022. It's 2.5 years ago. How many health insurance clients do you have today? And before then, how many did you have?
Oh, when I got to Ascend, I had 0. In January of 2022,
0.
Yeah, I had 0 then.
0. Okay.
Let's see, where are we? 24?
That is amazing, dude. 24 clients. That is something you should be incredibly proud of. And you must be doing something right. And, I like to say that I think one of my strengths, at least I hope it's one of my strengths, is authenticity. You're going to always know where you stand with me. I'm going to give you the good, the bad, and the ugly. It's really just about shooting people straight. And I think, you have that as well. And that must come across, because there's no way in hell you'd have that kind of success. That's like a hockey stick, graph in terms of your growth. There's no way that happens without people trusting you. And I think that all just kind of boils down to, you do have a ton of prior sales experience. You're not an overnight success. You did struggle early on, but you found a way to iterate and you made some changes, and that, then it was you were kind of off to the races. And yes, so that does kind of translate into anything that you do in sales. So you have that piece down, but if you didn't back up what you said and deliver, there's no way you'd have the success that you have. How do your clients feel about, making this transition? And, you mentioned Ben Connor before. He's another guy that's in our mastermind, and he, to his credit, he's a very wise young man. He basically said, meet a client where they are. And I think that's really, really smart. So the idea is not to jam a strategy down anyone's throat. It's really a dialogue. And sometimes you can make a small tweak here or there so that you're not going from, kind of ice cold to red hot. There's more of a an ease, a transition, a phased in approach. And maybe you do have a big picture game plan over the course of the next 3-4 years for where this thing can go. But you don't necessarily want to come in and say, okay, you're fully insured today. Based on our analysis, you're spending, 50+% more than you ought to be. The numbers kind of prove it out. But that's if we, kind of jam the accelerator all the way to the floorboard. That may, that's going to cause some disruption, some discomfort. But there are plenty of baby steps that you could take along the way to get you on the right path. Would you agree with that?
Yeah. I think meeting the client where they're at, you got to do that in any business, regardless of what you're doing. To do it right, I think that's the right outlook. And I think for me, I haven't always had the luxury of doing that. In the sense of, like, I'm going to go into every meeting and say, no matter where you are, I can help you. Because that when I first started, that wasn't the case. What I knew when I first started was the innovative side. I had to go learn what the other side was doing.
Yeah.
And so, one of the things that has happened for me that I think is real is that a lot of the first initial clients that I got were, the part of the market that their, hair was quote unquote on fire financially, in the sense of, they just got a massive increase, or, they're just looking at this cost in a way of like, I cannot afford this. What can I do? And I caught them at the right time. I genuinely think that was part of it.
Yeah.
And I think what's allowed me to retain them is a different story, but I think that, it might be good sharing this. Like, one of the things that, I consistently look through the lens of tech. I just can't turn it off, right?
It's a sickness.
It's who I am. Like, it's built into, I grew up in the military. You kind of grow up in your 20s. I grew up in the military, and I grew up in the tech space. And
Gotcha.
one of the things that I think is interesting is that in this industry, your account manager, your broker account management team, however that is structured, they are in charge of being responsive. They're not in charge of being, I'll say it a different way. Broker, account management, this industry, responsive. In the tech industry, you have to be responsive and responsible, because the tech company that works there is the company that provides whatever product that is the technology. So when you turn around to an account manager, the same company is managing your problem that is responding to your problem. Versus in this industry, you come to me as a broker and you say, hey, like, I got an issue, something's happening with a claim. Well, that person's going to turn around to, the carrier, Cigna, United, Blue Cross, whoever it is.
Sure.
They're going to turn around and go, okay, hey, this is going on, fix this for me and come back to me. So then the broker gets that information back, and the broker goes and takes it to the client.
Yeah.
And so, for me, I've approached client success from a standpoint of, I am responsible for your disruption. I am responsible for things not going correctly. I'm responsible to fix these things. Even if they're not all in my power, I'm responsible to make sure that what I told you at the beginning happens. And I've 100% had that. I've had, disruption that's created things that I've learned from, that I've learned with clients on. And I've done things where they knew at any time, I will step in and I'll do everything in my power. Like, as an example, we made some changes that were pretty big to one client like 2 years ago, right at the beginning. And we go through open enrollment, and they were doing it because of being hair on fire, and so their first effective day. So if they were June 1st. On June 1st, I worked from their conference room all day long.
Mm-hmm.
And I just sat in there and said, hey, I'm just here in case anybody wants to talk to me about the plan. Now it's effective. They got comments, concerns, questions. If they've got things going on that they want to involve me in, that I can connect them to the right people. I'm going to just, I got permission from the business to just work from one of their conference rooms all day long. And I was on other calls, and I just told them, like, hey, if somebody comes to this door, I'll hang up whatever it is I'm doing. to make sure that they know that since this is such an overhaul, that my cell phone access to me, none of that is an issue. And I think, you meet client where they're at with innovative ideas, with exceptional service, and really, really trying to say, I believe so hard in what I'm telling you that I will fix what these things are at all possible.
That's brilliant. I mean, that's not only smart and the right thing to do, but it's so business 101, right? Just be a man of your word. Do what you say you're going to do when you say you're going to do it, and deliver for your client. And I think so many people just kind of talk the talk, and or they win a case, they win a deal, and then it's crickets, right? It's I tell all of my clients, and even my prospective clients, I'm far from perfect. There are going to be mistakes. There is going to be disruption. It will happen. It's not a question of if. It's a question of when, right?
Right.
And my commitment to you is you're never going to be swinging in the wind.
Yes.
My team is responsive. You're going to hear back from us generally same day, within hours, but it would be, I can't remember the last time any of our clients waited more than 24 hours. It just doesn't happen for a response.
Yep.
So you have to back up your promise and your commitment to them. And if you're not doing that, then guess what? Get the fuck out of the business. You're in the wrong business.
Yep.
So I love that. And I mean, you being there, believe me, I know that they appreciated that. I'm sure that the employees appreciated that, and I know that leadership appreciated that, because you're a man of your word. You're backing up your promise. That's huge.
Yeah, we've done it. We've done it multiple times since. Not in every scenario. It just depends on what the thing is. But I did it another time for another group, and they had some broker problems. They had been through 4 different brokers in 4 years or something like that. 3 years, Jesus. 3 brokers in 3 years. Just had a really tough go with it. And I do the same thing. First day, I sit in their office, and the HR manager went and asked the CFO, "Hey, why is that? Why is he in here? Like, what is he doing? Why is this guy working in our conference room all day long?" And I only know this because the CFO later told me, but the CFO responded with, "That's what a broker is supposed to look like."
Ah, that's great.
And like, I heard that story and was like, I'm kind of just, there's certain things of this where, again, I don't know. I'm going off of what I did in the tech industry and saying this is just the right way to serve people, but I don't actually know what other people are doing.
Right.
And I think it's what people want. It's what these groups, it's what they want.
Dude, that's awesome. Well, listen, we could talk for days, you and I. But this has been super informative. It's been great getting to know you. I hope I know the audience feels the same way. You're a great guy. You served our country. Thank you for that. Your dad served our country. Thank him for us. We certainly appreciate that. There's no greater honor, in my opinion. And in terms of what you're doing in the space now, there's no question in my mind that you're on to something great here, and that there are only better days ahead. So thank you, Daniel, for gracing us with your presence today, sharing your words of wisdom, and for all that you do. So until next time, folks, peace.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show, and join us on the next episode.